asking how would this left-right crossover affect the yin and the yang, and I think that would probably get a little bit tricky there. I think you would still primarily look in the left eye for the yin aspects, and look in the right eye for the yang aspects. But it could get a little bit tricky. Did you have anything else you wanted to say on the personology, or we got that? Okay. Let's get the slides again. Thank you, Matthew. And thank you, Elizabeth. Okay, let's go to the next one. Now, what do we got here? Is this 64, Matthew? Okay. I think one of the things we'd probably want to look at in this particular one is going to be the either the adrenals or possibly the upper part of the leg. But I would actually, what's another thing that might be, Donna? Be a very good possibility of the appendix, because that's roughly where that's going to show up on the chart there. Now, what might this be up in this area? Okay, where in the back might that be? Okay, if you look at where the spine is laid out in the chart, where is the spine when you get up here? It's way in over here, right? I mean, the spine kind of runs like this. So this is not likely to be right along the spine itself. It could be up in the scapular or shoulder blade, or it could basically be more in the upper back in the musculature. But what's another thing that could show up over there? Okay, look at your eye chart. Where do you find the ribs? Okay, where do you find the ribs in a right eye? Okay, you find your ribs up over here, right, in a right eye. You find them up around 8:30, 8 to 9 o'clock. Which half of the body is more or less lateral here in the eye? Okay, the front of the body, just overall mainly. What part of the body is more or less over here? Okay, so where do your ribs attach? They attach in both places, because they attach in the front to your breastbone, but they also attach in the back, to your spine. So the thing about it is Jensen is quite correct in placing the ribs over here, and that will really be what part of the ribs? The front of the ribs. But where else do you got to place the ribs? Back around the spinal area as well. So you've got some other possibilities that we have to consider, and this is why you have to be a little bit creative with your iridology, and not just stick to the chart, and why you really need a series of like transparent overlays to put over an eye chart, because you need one just for the bones, really. You need another one just for the muscles. There's a lot of other stuff you got to look at here. All right, let's get the next one there. Okay, this is going to be a problem in the uterus, and what do you notice in particular about this? Okay, where exactly is this located? What zone? Okay, it's really out in zone 4. Where's the uterus on the chart? Okay, in here in zone 3. So what have we got going on here? Okay, a probable prolapsus of the uterus where this is moved out. Now, what's going to happen as that heals up? It's going to get lighter, and it's going to move back in. It's going to lighten up in color and move back in there. Okay, why don't we get the next one? Okay, another uterus right there. Okay, next slide. Okay, problem in the this will be a problem in the left ovary right here. How severe of a problem might that be? Will it be genetic? Okay, what is that I know it's a little moldy here, but what is that lesion? What's the color within that lesion? It's fairly dark, and what's the shape of the lesion? Pretty narrow lesion, which will indicate a more severe problem. Okay, by the way, just to skip ahead to the sclerology briefly, what area is this right here? Okay, that's going to be the back area. If you see a blood vessel in the back area where it comes in like this, then runs parallel to the back area, and then moves back out there, That's what's known as a degeneration line in the back. Now, one of the things that you're going to find, if you see an individual who's got this, for example, if this individual has it here in the left eye, but not in the right eye, this is probably going to indicate what about the back? Does anybody remember? A curvature. Which way would it curve, Jenny? If you got it in the left eye but not in the right, it's probably going to pull to the left, the side that you've got this on. So what are you actually going to have in the spine most likely? You're going to have a scoliosis. You're going to have a lateral curvature in the spine. A lot of times if you've got the degeneration line in both eyes, you got a problem, but you might not have a scoliosis because you probably have a lot of tension in the back muscles on both sides, so it may more or less even out there. Let's hit the next one. Okay, what do we got right up in this area? Okay, we actually have a left eye here, and this is actually going to be the tonsils. Now, what do you notice about this eye overall? What would be one pretty obvious characteristic here? Very, very, very heavy mucoprotein buildup. Extremely heavy. I think you can all see this, right? Mucoprotein all over the place. Now, what would be the relationship between this spot in the tonsils and the mucoprotein buildup? What would be the relationship between a congested lymphatic system and tonsils? Tana?
It's one of the eliminatory. It is. It's one of the assisting organs that help eliminate mucoprotein and the waste products, doesn't it?
So if as a small child you get tonsillitis and you get your tonsils snipped out, what's that going to do to your lymphatic system?
Well, it's not going to help them eliminate properly after that.
It's not going to eliminate properly after that. So what's that going to bode for the future?
Mucoprotein buildup.
A much greater tendency towards congestion in the lymphatic system. What's something, if you've had a tonsillectomy, what's another thing that often follows, 10 or 15 years later? Appendix. You'll often get the appendix out later. Okay, thank you. Next slide. You often get not always. You get plenty of people that have the tonsils out and never lose their appendix, and you get plenty of people that have the appendix out and still have their tonsils. But all the same, there's a fairly high correlation between tonsillectomy and then getting the appendix out, at a subsequent date. There's quite a correlation there because the appendix also has a lymphatic function. The appendix will also have a lymphatic function. Okay, oh my. That's a beauty. Is that a 69 there, Matthew? Okay. You're going to be dealing with the prostate right in this area. And what else might you be dealing with? Well, it's a left eye, so it's not going to be pancreas over here. This is a left eye, but you're going to be dealing with the prostate and what else? Well, if it's a prostate, I don't think it'll be a vagina. At least I hope not. So let's assume it'll be a penis out here. It's kind of a better match. That's why you can't just read the chart. You got to think. What was Elizabeth? What was your joke on that one? Why they didn't write the penis on the chart there where they have vagina? What was you had a good joke on that. What was it? Remember up in Carrie? We note that for some reason they don't write penis on the chart. They just write vagina. And what was it? You had a good joke on that, don't you remember? You said maybe you just can't see it because it's inside there. See, I believe in giving credit where credit's due on these jokes. So. Plus, I don't want anybody to think I'd think up something like that. So. Okay, we obviously might want to consider the thyroid here as well, because that's That's about the darkest pigment spot you'll ever see there. That's going to be a very, 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 very serious problem right there. Yeah, we'd want to check the pituitary as well. The lungs might be a bit of a problem here, and you can pick a lot of other things here, but that's going to be a very, very serious thing there. Okay, why don't we hit the next one? Okay, this is a known cancer, and I want you guys to tell me where it is. What time? Okay, look right in this area. All the way from the pupil out, you've got a very, very deviant fiber structure in here. You got the asparagus effect, and this is actually a pelvic cancer of the pelvis in this individual. But look at the fiber structure all along this whole area here. Quite a lot of problems here. Okay, but you've also got, as John would say, the asparagus effect in there, and this is a diagnosed case of the pelvic cancer. Let's get the next one. Oh, sorry about that. Yes? Okay. With the asparagus effect, what's that? No. With the asparagus effect, Tarek, you know how ordinarily the eye fibers are going to go from the limbus into the autonomic nerve wreath and back out. With the asparagus effect, what you're actually seeing is fibers that are moving out like this, and then not making it all the way to the edge. Watch this one right here. See how it comes out like this? It kind of stops right about there, and then doubles back and goes back like that. So it's going to look a lot like a piece of asparagus. You know what asparagus is? Okay. So that's the asparagus effect. It's a fiber that's very much out of place in the iris. Okay, next slide. Oh. Well, you've got several there. The whole area is a mess. Yeah, the whole area is a mess, really. I mean, if you look in there, it's really pretty much a mess from about here over to about there. So there's probably problems all over the place. They were diagnosed as having cancer of the pelvis, but pretty good odds they've got some trouble elsewhere. This will be a left eye, so that's quite right. You'll probably have a lot of the reflex stuff out from the sigmoid colon. If you got problems in the sigmoid colon, what can you do? Yeah, the implants, the retention enemas would be very helpful. And where could you hold points for the sigmoid colon? Okay, and the fascia lata, the muscle on the side of the leg, where in particular in that for the sigmoid? Okay, above which knee? Okay, above the left knee. Okay, would you want to hold points right on the abdomen on this individual? That might be a bad idea, huh? Okay, next slide. Okay, I believe you got an adrenal problem right in this area. A bit of a black bush. What points might be a major priority here? Okay, the heart and the heart firing. And what would be another major priority? Okay, but what else? Okay, pancreas would be a major problem because with the dark pigment spot like that, you got a pretty good, pretty much 100% chance of cancer with a spot that dark, because that's really a dark brown to black spot. And 10,000 cadavers can't be wrong, so you probably got something. You know that 50,000 Elvis fans can't be wrong, so 10,000 cadavers can't be wrong. So we probably got ourselves a problem there. Okay, what else might we be dealing with? Okay, lungs would be a good one. And what about over here? Back could be a possibility, although that really looks like it's inside the autonomic nerve wreath to some extent. So we might want to check out the small intestine. One right there. Could you just say something about this? It is a left eye, yes. Left eye. Oh, switch it on. I think the mic might have got switched off.
Could you say something about this lighter patch here?
Okay, what might that be in the eye? That's a pretty crowded area on the chart, but one of the things you might have there would be the anus and the rectum. That's one possibility you might have right in that area. You could ask them if they have hemorrhoids or anything like that. That'd be a strong possibility right there. Yeah. Okay, next slide. Yep. Because there were black diamonds? Yeah. Okay. Where might we have a problem right here? Okay, up in the back and possibly the spine. Possibly right along the spine. Okay. By the way, how much sensitivity or sensation might that individual have in that area? Okay, how come? Okay, what does the eye look like? We got a pretty dark scurf in there, so they might be quite numb in that area. Now, just consider this ugly scenario for a moment. Suppose you have a person with an eye like this. They got a lot of back problems. They don't have a lot of pain there, but they're just kind of always out and always tight in the upper portion of the back. They go in for massage. They go in for chiropractic adjustments. What's the risk here? You could run into some pretty serious problems here. So bear in mind that the iridology is going to be really something you ought to know, regardless of what you're doing. If you're doing anything that involves putting hands on people, like adjustments, body work, or anything, it'd be a very, very good idea to have enough iridology to be able to recognize a problem like that. Okay, next slide. Okay, I think that's another pelvis there. Is that the same one again? Looks pretty similar. Okay, next slide. Okay, could you give me the number on this one, Matthew? 74. Okay, what we have here is going to be is actually an injury in the pelvic area. You see this pigment spot right here, and also out to this entire area. Okay. Next slide. Okay, again, a problem in the pelvis right out here. And what might we be dealing with over here? Okay, breast would be a very, very good possibility right there. That would be the first thing that I would guess there. Okay. One of the things you'll notice there will be pigment spots for the breast that will be fairly large in size, but a lot of times when you look at the chart and you'll notice that circle that represents the breast is relatively small. So a lot of times in my experience with breast cancers and problems there, you often do get fairly small pigment spots. Whether they might be light or dark in color, you often get quite small pigment spots to represent the breast. Okay, next. Okay, another problem over in the pelvis there. Now, what might that be right there? It could be in the lung, and it could also be what? Well, it's a right eye, so it could be over in the ribs. It could also be in the pleura, which is what? It's like the sac surrounding the lungs there. What about this right here? The bronchioles. Now, there also is a situation that you'll get in some cases where you'll get a pigment spot exactly where the heart is found in the eye chart. And this will often happen when the person's had electric shock of some sort. When they've had severe electric shock, you'll often get a pigment spot in the heart area in one eye or the other. So that's another possibility, but bronchioles would be worth checking out. Let's get the next one. Let's stay on that one. What zone is that in? I would say, looks to me like the autonomic, the A and W is right about there. So I would say it's maybe to some extent in zone 1, but I think it might be more in zone 2. So we've got ourselves a right eye, so that's going to be over probably in about the right portion of the transverse colon, be the thing I'd look for first. Okay, next one. Okay, we got ourselves a right eye. Actually, this is one of my favorite slides. Looks like a kidney bean there. But this person has severe pain back under the shoulder blade. Now, do you think a good massage would do him any good? Might be a very, very bad idea there. This is most likely quite a severe problem in the scapula. Now, is there any place else where this person might have some problems? Okay, you look straight across over here, and in this area you've got an obvious color change there. What about the mucoprotein buildup? quite extreme. And what do you always check when you've got the mucoprotein buildup? Okay, the thyroid. Do we have anything worth noticing there? Okay, absolutely. Possibly the adrenals as well. Okay, let's get the next one. That last one, by the way, that was cancer in the scapula. That was a diagnosed case. So it was quite a black spot. Okay, this would be another problem out in the scapula right here. Now, where else might we have problems? Or pancreas would be a real good possibility as well. Possibly gallbladder, but with that shape, I would suspect the pancreas. Okay, next slide. Okay, again, a lot of pain up between the shoulder blades. No wonder. Next slide. Okay, a lot of problems in the lower portion of the back in this individual. Okay. Any questions? I think that's the last one in that tray, isn't it, Matthew? Okay.
Yep, just leave it right there. All right, on this particular eyeball, I'm going to go through this very carefully with you. If I could have all of your attention here, please. Okay, now those of you who are osteopaths and those of you who are into massage therapy, those of you who are into adjusting of any kind, manipulation of any kind, I want you to pay very close attention to this. The symptoms of this individual is they go to the chiropractor, and 5 minutes after they leave the chiropractor, they're back in very, very deep pain in the neck. Now, if you have a little background on iridology, and you take a look in this person, you just kind of scan around here very, very quickly, and you see what stands out, and that's just obvious. And you take a look at that, and that's going to be, if this is about the 7th cervical vertebrae, and then here's a 6th, maybe this is the 5th, 4th, 3rd, 2nd, 1, etc. Then right here, this is going to be approximately on maybe the 5th and 6th cervical or cervical vertebrae. And it's a bush, and it's got black in it, and it's spreading out like this, okay? Now, if you're into osteopathy or doing any type of massage work around this neck where it's very, very painful, I would advise you to leave that alone. Because if you were to adjust this individual, if you were to adjust them, you could break a vertebrae in little smithereens. You follow me? You could break it into smithereens if this is perhaps a tumor which would infiltrate that vertebrae. You leave it alone. You may hold gentle points on it with your thumb or finger, but you don't adjust that under any circumstances. You leave it alone. Now, if you take a look at the little feelers coming out from it, if you put a person on a heavy program, then in about 2 weeks, all those little feelers are going to get nubbed off. The discoloration is going to start changing. You start working very carefully on all of the endocrine systems, so all of the hormones can act as catalytic agents for the endothermic, exothermic reactions or the healing crisis that would take place in here, and then let that take care of itself. Then, after the pigment changes, after the pain is gone through body electronics, then you can very, very gently put that in with no trouble whatsoever, because all of the bone has been rebuilt, all the calcification is dissolved, and you will not get yourself in any trouble at all. Is this clear? But if I see this in the eye, I don't touch it. I don't touch it until I get change in the iris of the eye, and then when I do get the change that I'm looking for, then I can manipulate with confidence and there's no problem whatsoever. Donna.
I may have missed something earlier.
Speak up, please.
I said I may have missed something earlier, but are you then, in addition to where the spine is generally shown in the chart, then we have what, the cervicals up behind like the head, you know.
Oh, the
eyes,
cervicals
jaws,
will be right up in this area on the chart.
Okay, from like 10 to
Where
11.
it says neck.
I'm not seeing it.
This would be a right eye. So it's right there.
Okay.
Got it?
Yeah.
Like 180 across.
Is that going to be reflected in both eyes?
Well, you have neck in both eyes, yes.
Okay, thank you.
Okay? And you have the back. The back would be right down here, okay, in this area. You see where the back is, Donna? And the neck will always be just opposite where the back is. Got it? The back's over here. The neck will always be over here. Okay. Yes, sir.
Thank you. Will you have to wait until that black spot has disappeared before you do any manipulation?
No, you don't wait till it's disappeared entirely. What you do is you wait until it is completely nubbed off, and then it's changing color to probably a lighter brown. And then there'll be no pain in the neck because you've already got rid of that with body electronics. You've already got all the electricity out of it by the point holding. And the electricity, when that electricity comes out, you have very rapid healing of the bone structure. And the person has no pain in it. At that time, then, you very, very carefully and gently put that bone back into place. Okay? And we'll get into that at a later time about the 5th and 6th week. Okay, next slide. All right? Now, I want you just to swing around circularly. Can you see from there, Anita? I'm in your way. Yes. If you can swing around very quickly, is there anything that stands out? Eh? Right in here, correct? Okay, quick story. I won't tell you the full story. Lady was bedridden. She was in pain. She had been to every medical doctor, every psychiatrist, and the final conclusion is that it's all in her head. And there is nothing they could find physically wrong with her or neurologically wrong with her. It's all in her head. Well, finally, one of her friends convinced her in Oklahoma that she should come and see me, where I was in Tulsa, Oklahoma, working with a lot of people at that time. But the promise is that if she were to come to see me, that they do not, under any circumstances, let me know what the problem was, which was severe pain in the upper back. So she comes in, sits across from me. I look at her eyeball, and all I could see, I just swing around here, and I look, bingo. And I told her, you have tremendous pain in the first and second thoracic vertebrae, right here and here, and you have tremendous pain all the way down into the tailbone. And she looked at me, and her husband, who is a plumber, who is totally skeptical, he says, you're right on, now what do we do? And I had their full support from that moment on. And just, you know what the problem is. Now, you see the black in here? You know what the problem is when you see the little black bushes. And when the medical doctors can't find a problem, and the psychiatrists can't find a problem, and they tell the person it's all in their head, they're doing that person a severe disservice because they haven't got any training in iridology. And yet, oftentimes, your medical doctors will be the first ones to put iridology down because they haven't studied it, they know nothing about it, and yet they're the first ones to put it down as a false pseudoscience. But right here, there's your backbone. You can't miss it. You follow me, folks? Okay, so what did we do? STO, pineal, pituitary, thyroid, right on down the list of things on your flow sheet. Now, you all have the flow sheet. Okay, you go right down that list, and then finally, after you go all the way down the list and get everything taken care of glandularly and so on, getting everything working, then you very gently, by that time, this color has already, pretty well the pigmentation has been gone, and then you go back in here and do all the work up and down the spine and get all the calcifications out of the spine. And after, not before, after the calcifications, every vertebrae, both the left side and the right side, are completely gone, then you can very gently go in here, adjust that, and you have a very happy lady, totally and free of pain. You get the sequence. But don't go in here and adjust that until that's cleared out. And don't do it until the point holding has completely dissolved all of the calcifications up and down that spine. And you have done that person so much service, and they're so happy afterward. Neil.
Yes, what about massaging the muscles very thoroughly to the point where the vertebra in a normal person would actually go back in?
I'm very happy you asked that question. We're going to cover that in body electronics, Neil. But on any type of body therapy, whether it be massage work or deep tissue massage or whatever, if the muscles are numb and you're massaging them, can they really feel what's going on in there? Not at all. And so therefore, if you're going to be very, very wise and become a good therapist, and some of you are going to kind of wince at this a little bit, but you're going to restore the nerve supply and circulation back to the muscles first with the STO point. And once you get that restored back to the body to where you have nerve supply and circulation back, then when you do the massage work, the muscles talk to you. And the muscles talk with the person. You find out where the pain is. Many times you rub a person or rub their feet, there's no feeling there. They know that you're rubbing the foot, but there's no pain, there's no feeling. They don't feel anything. But after the STO point, everything comes alive. The nerve supply is back to the muscles and tissue, for the most part. Now, you'll have a few complications there, because if you have some spinal problems that need to be corrected, that will shut the nerve supply and circulation off. Now, so far, I have found 5 people here where they have good feeling down the legs, okay? But in the arms, nothing. When I do a little pinch test, absolutely nothing in the arms and fingers. And so what you need to do on that one is simply go up here on the first thoracic vertebrae, put that into position, and then all of a sudden they have feeling down through the arms, and same as the legs. And it's not the STO problem if you're numb in the arms. You got that? It's not the STO problem if you're numb in the arms and you have full feeling in the legs. It's you have a block somewhere along the spinal column, and that spinal column has to be corrected. And you can do that with point holding and get the calcifications out of it, but there may be still the subluxation there where you need to have that vertebrae rotated to take the pressure off that subluxated nerve. You got the idea? Where the pressure's on that nerve. And then when that's relieved, you have all the feeling back, nerve supply back, circulation back. Doug?
It's worth checking not just one arm and one leg, but checking both, because you'll sometimes run into a situation where the person will just have one arm or one leg that's totally numb, whereas the other one has quite good nerve supply. So you really want to be thorough and check all 4 limbs.
Okay, you got that? Any question there?
I saw an individual one time out in Hawaii who had wonderful nerve supply everywhere in the body except his entire right leg, and you could go all the way up into the groin and not get any pain on the right leg, whereas he had perfect nerve supply everywhere else. So obviously not an STO problem.
After the nerve supply was restored to the right leg, then he was groining. Next slide. Now on this one here, check around. Where are you? Yep. Now you'd look at the person, you sit down and look at that, and you have a real big black bush right in the center of the spine. The person may be totally numb in the spine. Totally numb with no feeling whatsoever. And therefore, no nerve supply, no circulation, and the toxins in the body will settle out in the tissue of greatest weakness, causing metabolic breakdown. Can I use Anita as an example? Anita, come up here, please. At one time, Doug will remember this, Anita was bent over like an old lady, about like this, with huge calcifications up and down her spine as large as golf balls. Right, Doug?
Yeah.
Okay. She had numb spots in her back where she had no feeling whatsoever. Her back was covered with a lot of big black moles. They're all gone. The thing is we've had to work. And some of the calcifications were just huge. And by working on those calcifications and working them out one at a time, then suddenly she started having feeling to where now I don't think there's a numb spot on your back.
I'm feeling everywhere now.
But the thing was, she had numbness everywhere up and down here in different spots where there's nothing. She couldn't feel a thing. And even when you worked on the calcifications, you couldn't feel any pain on those areas.
Right, yeah. There was definitely areas where I would just touch it, no feeling there at all along the back. And now I could feel the whole back.
And the calcifications are gone. Now, this is what takes a lot of time and a lot of work, and it's taken about 8 years. Now, there's a few other little things we still have to work on, and those things keep us humble. That's the way it is, isn't it? That's life. Okay. Back, lights, doors. Okay. Don't adjust this. Don't manipulate this. Is that clear? Lots of times you want to get your hands on somebody and start working with them, you know. Don't touch this until we get the nerve supply and circulation back through other parts of the body. Then this will come right. Next slide. One spot right here. See that right there? You know where that is? Lower back in the lower lumbar. Right there. Continual pain. Person's in pain 24 hours a day. And all it is a black spot there in the iris of the eye. Need I go any further on that? You already know what to do. Full program. Put them on that, and that dissolves away. And then you can start working with point holding on that and work on that with confidence. Next slide. Righty. The bottom line, do you see this discoloration right here? See this? There's your problem area. You go around here and look for a very distinct color change, and where you have your color change, this is all mucoprotein. Everything is clogged up. There's your problem. Now you have to get the nerve supply and circulation back in there. Put a person heavy on your lymphatic enzymes. Get that mucoprotein out of there, and then things will start coming right. But this will be in the lower back. Next slide. Okay, this is a gentleman who is a great, shall I use the word, he's into the movies. I won't give you his name. Right here, you see this very heavy-duty nerve ring in the back area. He has a severe curvature of the spine. Now, the curvature of the spine we'll talk about in body electronics. Next slide. So you look for the nerve rings in the back area. Okay? I don't know how this slipped in, but that's a bronchial problem with little black spots in here where there's a lot of coughing. Let's go on to the next slide. There we go. That's one I wanted. Now, here, if you take a look carefully, which eye? This is the left eye. To the right, as you're looking at it, the person has one problem. What's their problem? Neck. Now, here again, you've got a black area through here on the 6th and the 7th cervical vertebrae. Always in pain. They go to a chiropractor, they get adjusted by the chiropractor, and 5 minutes after they leave the chiropractor, they're in pain. Now, once in a while, you'll find a chiropractor that breaks the vertebrae during an adjustment. You listening carefully? The vertebrae is broken, the person is in tremendous problems, and usually you have lawsuits involved in this sort of maltreatment. I don't want any of you to get in trouble. So therefore, after you learn to do manipulation, then you make sure that you know when not to do manipulation. You look in the eye very carefully. If you see something like this, anywhere in the neck area, you don't touch the 6th and the 7th cervical vertebrae. Can you adjust the 1st and 2nd? Carefully if you know how to do that. But the 6th and 7th you leave alone. Now, I just want to clarify that with you. After you hold the points carefully with body electronics, this will lighten up, it'll change in color, and then after it changes in color sufficiently and prayerfully, I don't think I've said this, I'll say it now, you never treat a patient without first of all going into prayer to know exactly what to do for their highest and best good. And if you feel, for whatever reason, caution in giving adjustments, then you don't give adjustments. You just don't do it. But if you know that this is going to help that person, you go ahead and do it, and you know that the results will be forthcoming. So this is something to be very careful of. Next slide. Okay, Doug, what do you see? See this right in here?
Yeah.
The heavy swollen fibers with the black, that's right in the neck area. That would be the lower thoracic vertebrae, and are not thoracic, cervical vertebrae, and you're going to be in trouble again. That's in the neck. Next slide. Okay. This lady's a nurse in Chicago. Her husband is one of the top medical people in Chicago. She had a huge growth in her groin. It stuck out considerably, and it was growing rapidly. And because he was a medical doctor, he knew that chemotherapy and radiation would do her more harm than good. Okay? He brought her to me, and this is before my incarceration. He brought her to me, and we worked on her there, and just simply put her on a program and held points a few times. This big black blob disappeared, and the tumor went right down and disappeared entirely within a matter of maybe 2 months. Was she happy? Very much so. Was he happy? Very much so. Was he supportive? Yes, to the degree that he told all of his medical people about this work and how wonderful it was. And so he got in trouble, and as a result of that, the medical association began to realize that they lose their own forces, and then I got in trouble. Doug.
I read about a study a few years back where they took cancer doctors, oncologists, cancer specialists, and they were it was a confidential survey, so the answer of a particular doctor would not be linked with their name. And they basically asked them, what would you do if you had cancer or if a family member had cancer? And about 80% of them would have gone outside the country to get treatment that was illegal in the United States, where in the U.S. the only 3 things that are legal are surgery, chemotherapy, and radiation.
For a period of time, you had another material in Oklahoma, and only the state of Oklahoma, where they had what they called a lelevirum. And it was the extract of the ovum of a lily plant. And you know these big white Easter lilies? They took the ovum of that and made a special extract out of it, and that would, when injected into a tumor, would dissolve the tumor. Now that was legal treatment in Oklahoma until the medical profession was able to put a kibosh on it. But that's just something, if you ever run across the lily plant, the ovum of the lily plant, the extract from the ovum, and inject it into the tumor dissolves. And that was legal in the state of Oklahoma for many, many years until the medical profession put a stop to it. Now, again, this is all going to change when people become more determined and more enlightened, where they say, you will not tell me what I can and what I cannot do when you are incorrect in your activities. And then the laws will change when people make a big enough stench over it. Next slide. Okay, I want to show you this particular eye. Right up in the epileptic area. I believe in the Jensen chart now it's called the dizziness area.
Yeah, equilibrium dizziness center.
Now the dizziness area of the chart used to be called the epileptic area. And if a person has epilepsy or dizziness or situations where a person passes out and goes into a spasm or a petit mal or what have you, this gentleman here was kicked in the head with a horse. And he developed a very, very long closed lesion. After his first cranial, he was having about 7 grand mal seizures a day. Okay? Now, after the cranial work, he had no more grand mal seizures, but this particular long, narrow, closed lesion became shorter and wider, and the fibers moved out in it, which before was quite dark. And he had no more seizure activity. But if you have epilepsy or any type of petit mal, which is where a person just blacks out temporarily, and you pick him off the floor, you look at this area right here and see if there's any sign of this particular. Now this, of course, is going to be your left eye, and the right eye will have a similar one in that because of the bilateral nature of it. But really, you find this more in the left eye than the right eye. Okay, any questions? Next slide. Okay, another groin. Right down here in the groin area, another huge growth. And the growth disappeared as the black bush dissolved away under the onslaught of the enzymes and the minerals and other nutrients. Do you hear me? You all understand that. You got a big black bush in the eye. The person has a very obvious physical problem. You put them on the program, and as that simply dissolves away in the iris of the eye, that will tell you exactly what's going on in that body part, and that body part heals and regenerates. It may take a while, but you have to be consistent on it. Okay, next slide. Okay, this gentleman was in the Korean War. His sister was the one that was insistent that I have my points held every single day until I recovered from terminal bone cancer. And this man is a wonderful man. He had grand mal seizures every day where his house was an absolute shambles. Now, what would happen is when he'd go into a seizure, he'd go into a frenzy and swing his huge arms. He was bigger than I was. And he'd just swing his arms and break everything in sight. Glass doors, screens, 2x4s in the studs of the house. All of the what do you call the gypsum board on the walls?
Yeah, the wall board.
Wall board.
Drywall.
All of that was totally destroyed. The house was just shambles, and he had a mat that he laid on the floor. Now that happened during the Korean War back in the 50s, and he had been overrun by these human wave attacks from North Korea. And he was the only one left surviving in his battalion. The next day he woke up and was told they're shipping him off to the hospital because he was having grand mal seizures and didn't even know it and was tearing the barracks apart. But he survived. Now we worked with him, and because the seizures didn't begin until after the human wave attack, we thought that this was in some way connected with the fact that he was kicked in the head and left for dead, out in the battlefield. But that was not the case. What had happened is as a Marine, during his training, he had to hold himself perfectly still, without flinching, as the drill instructor kicked him repeatedly right here in the stomach area as hard as he could with his boot. Now this is toughening a person up so that they can become a good robot, become a good soldier. Well, this one guy made him an example before the entire training group there, and he kicked him repeatedly right in this area. And if you take a good close look right here in the transverse colon area, this particular area went at one time, the pigment spot went clear up here into the epilepsy area. You follow me? So the problem in the epilepsy area originated right here from the colon area. Now that was interesting. Now it took us over a year to get the memory of being kicked repeatedly in the stomach area by the drill instructor during the training that he had to become a Marine. Now sometimes that gets pretty harsh. In the meantime, he's passed tons and tons of corn. Is just a beautiful, beautiful man. And now he's helping people with tremendous, he's a lawyer now, and he's helping people just because of his love for helping people who have been taken advantage of by the government, by the tax problems and the banks. Okay, next slide. Okay, I want you to follow this very carefully. Now watch me. Let's just start down here and start moving around. Now you tell me where you see a delightful deviation from the norm. Where? Okay, come around this way. Okay, this man from Bismarck, North Dakota, which eye is this? The right eye. He had a brain tumor. They went in to operate. They took the top of his head off, and got down in there and took out over a pound of tumor out of the right side, the left side of his brain. Now, from 11 o'clock to 1 o'clock, this is the brain area. But that's the only part of the iris of the eye which shows what's happening on the other side of the brain. So if this is a right eye, which it is, and you have this here showing up in the brain area, you got this? This is the brain area which shows up in the iris on the right side, but he had on the left side of the brain 1 full pound of tumor taken out. He was sent home totally paralyzed, and there was nothing they could do. They didn't get all the tumor, and he was just resigned to death. Well, his little tiny German wife said, "No way." And we had about 5,000 people involved in Bismarck, North Dakota at that time, and so Body Electronics was really involved there. So didn't bring her husband down. I went out to the home, and I looked at this, and I said, yes. But we went ahead and put the young man, he's in his 30s, on the program. And in 1 month's time, he was up chopping wood again. He had totally overcome his paralysis. All of this in the brain area had cleared completely up, and he was back to normal. And whatever happened in the brain, where all that had been removed, it had all healed back over again, and the doctors couldn't understand why. But last I heard, he was still doing very, very well, and that was 10 years later. But they've been on the program and then doing just very, very well. Doug.
I'm a little confused on this because originally when I started studying iridology, the concept that I had, perhaps I was mistaken in it, was that the right eye would still show the right brain, and then recently we've talked about a crossover as well. You're saying now that this is just the left brain here in the right eye?
What I have always taught for years is what Jensen taught, and I found it to be true. Mm-hmm. This portion from 11 till 1 o'clock in the right iris shows what is happening in the left brain. right here. This is actually left brain because of the crossover through the optic chiasma. Okay.
And that's 100%.
Well, in the brain area, yes.
Okay.
Yeah. Now you do have other things where, like if it's not in the brain, it's down through here. That's definitely going to be transverse colon.
Right.
But outside of the autonomic nerve wreath, when the brain area, from 11 till 1, that's definitely the other side of the brain. Donna.
I'm not sure I'm seeing what I would recognize as being something that serious. Are we looking at the brown spots or something that looks more like catarrh or what?
Do you see these particular large swollen areas in here with the black going up through here, the black going up through here? This is all swollen and extended. The black going up through here, and this is all swollen and extended, black in here. All of this is the indication of what they call the Medusa effect. It's this huge amounts. Remember, the asparagus effect would only be one. But here you've got the Medusa effect, and this is what it looks like. It looks like, the Medusa, the multiplicity of snakes coming out of the head and this sort of thing. This is what you're looking at right here. This is all Medusa. And when you find this Medusa effect in the body, that will always be a massive amount of cancerous tissue. You'll find that from time to time, so just kind of keep that in your mind. But it's the swollen fibers is what you're looking for. Now you'll see a lot of people with swollen fibers. And I scratch my head a little bit because everyone has a swollen fiber or two up there, and I wonder, how far advanced is this particular situation? Now, if you go out here and if you butcher out a cow or a sheep, you'll find every single one of them throughout the whole body will have tumors of one type or another that you cut out during the processes of butchering. Now, I don't eat that meat anymore, but I've done my share of butchering, and I've seen these tumors in the animals. And if you go down here to where they have the big commercial butcher shops, what do they call them here? Abattoirs? Okay, and you have those particular areas. They're cutting these tumors out of the animals all the time. Now, this is when you see this type of a Medusa effect, and you can see that. Always look for the deviation from the norm, okay? And when you see that, you've got a definite situation. But this is on the right eye. The brain tumor was on the left side where they lifted that thing out, and they just put it right back again because they couldn't get all the tumor. The young man lived. Okay, Donna?
Can the Medusa effect happen anywhere in the eye?
It can happen anywhere in the eye. Doug?
With respect to the sclera and the portion between 11 and 1 dealing with the brain and looking for signs of stroke and things like that, is the right eye going to show the left brain, or is the right eye going to show the right brain in the sclera?
If you have a stroke, and between 11 and 1 o'clock, on the right side you have a big red blotch up here showing a stroke, it'll be on the left side of the body.
But, okay, so if I see a person with the right eye, and they've got the big red blotch up in there,
yes,
I'm going to assume that that's their right brain, so the left side of the body is
the left
affected
side
by the
will
stroke.
be affected.
The left side of the body.
Left side of the body.
So basically in the sclera, there's
which will come from the left brain.
I thought if your left side of your body was affected, that meant it was your right brain.
Not necessarily. But from here, you've got the situation. You're looking here. Okay? This is the iris of the eye.
Yes.
This shows a picture of the left brain,
what about
which will often affect the left side of the body. Now, you do have crossover effect.
So it's not.
If you have the red blotch up in here, which would signify the left brain, then the stroke will affect the left side of the body, and the left side of the body will be numb. You'll see that over and over again with stroke patients.
So the sclera between 11 and 1 crosses over too, or not?
Yes, sir. So you're looking up here in the sclera, and you're actually looking over here. This is brain area.
Yes.
Brain area. Okay, this you're looking here on the right side, but it's actually telling you what's happening on the left side of the body. The program remains the same. You don't have, the program remains the same. The point holding remains the same.
Okay, I'm really trying to get something straight here. Forget about the eye for a second. If a person has a stroke in the left brain, doesn't that affect the right side of the body primarily?
Okay. Now that'll be true, but not always. You don't hold to that because you have crossovers.
Well, I'm not concerned about crossovers in the iris at this point.
I'm not concerned about crossovers either. You have that in the brain.
So a stroke on the left brain could affect either side of the body.
Okay, let's say that you have a problem up here, neurologically, in the brain area. Okay. Now you have the 5 sense center. Okay, in this side, if you have it here, in the 5 sense center, you can have a neurological deafness in the left ear if you see it in the right iris.
That seems totally contradictory to me.
Well, that's the way it is, Doug.
Well, just hear me out here. If this is the right eye, and
Yep.
you're saying it represents the left brain, right?
That's correct.
And we've got something neurological in the left brain, wouldn't the deafness then be in the right ear?
Not necessarily.
I'm growing ever more confused here. Is
Okay,
anybody else?
I hope you are confused. Now let's take a look at this. If you have a big, watch this. If you have a great big red blotch up here in the eye, in the brain area, you got a brain tumor, okay? This is on the right side. From a physical point of view, you can have numbness going down the right leg and the right toe will be numb. But you'll have neurological deafness on the left ear. Your left eyesight will be affected. The sense of smell, which would be on the left side, would be affected, but you don't recognize that quite as readily. You would have problems neurologically on the left side of the body.
I'm totally confused.
I'm glad you are, because this is where there's a lot of confusion going on in this, because you will have a crossover of nerve activity where in some parts of the right side of the body will come from the left brain. Also from the left brain, some things on the left side of the body will be affected. Now, you don't find that in the textbooks, but you find that in reality when you're dealing with the iris of the eye. And this is what Jensen has put forth.
John,
Yes.
why don't you just tell us what parts we're going to find on which ones are which, just from the get-go, so we don't sit here and play 50 questions trying to find out what it is. You know, tell us which ones are going to show up in the left eye on the right side of the body, and which ones are going to show up in the left eye on the left side of the body, so we have an idea what we're working with.
Okay, Donna, look here and listen carefully. In point holding, if you hold a spot on the left side of the body, you will realize that all points are going to be bilateral. So you spend 90% of your time working on one spot. Doesn't matter whether it's pineal, pituitary, thyroid, heart, or what have you. You work at it on the left side of the body, and 90% of that is going to be dissolved over here on the right side of the body just by holding points on the left side, because all points are going to be bilateral. Now, neurologically, in the past, they say this is the way it is. Well, it's not that way anymore, because the body is a hologram, not just tied together by nerve supply, not just tied together by meridians, not just tied together, even an acupuncture now is totally confused, because anything can cause anything, and it's based on the fact of the bilateral nature of the human body. So something in the left brain can affect both sides of the body. You follow me on this? It's not just black and white, that if it's on the left side, only the right side is affected.
Okay.
That just isn't so anymore.
So when would you usually...
Pardon me?
When would you usually find the crossover effect? In what areas?
You find it in all areas. That's what I'm trying to say. There's nothing that is immune to the crossover effect. Now, you take a body like mine, my nerves on the right side go clear over to the left side. My nerves on this side go clear over to the right side. And so the iridology does not apply to me because I have the crossover effect in every single organ of my body. You with me? And the same thing is holding true because there's so many people out there with the same situation that I have right now. You can't look at iridology from the old way of reading it, that if it's in the left brain, only the right side is affected. It isn't that way anymore.
I'm not looking at the exceptions. I'd like to know what it usually is. We're always going to look for exceptions.
There's no usual.
There isn't something that happens more.
There's going to be exceptions every time you work with a person. And it's going to violate all the rules.
Right, but most of the time you're going to have it a particular way.
Not most of the time you're going to have it a particular way. Because as soon as you take that attitude, you're going to be disappointed and confused. Because you're going to come up with something that just doesn't fit a certain pigeonhole. The intellectuals always try to get a pigeonhole for everything. We're out of that realm. There's no pigeonholes anymore, folks. There just aren't any pigeonholes.
If that's the case, John, we can throw all of iridology out the window because there's absolutely no rules. So you are already using something that is normally where this is usually, or most of the time, this is what happens, because if that isn't most of the time what happens, then the whole thing's wrong and none of it's any good.
No, it is highly mobilized. It is highly mobilized. Now, I've gone through this myself, what you're going through. You just throw your hands up and say, well, what can you count on? And the answer is nothing. Okay, you've got an enzyme ring.
Something to start with. That's
enzyme
all I'm looking
rings.
For.
A zone 1 ring, I haven't found exceptions to that, Donna. Okay, you start out with the enzyme ring, and you know that you have to correct long-standing enzyme deficiencies. And then, what is that going to correct first? I don't know anymore. Because what that corrects is what the person is willing to go through a healing crisis, which will differ from every other's person on the healing crisis. So you can't be sure as to what's going to heal first. Okay, you know that. Then if you understand that, then you can also understand that even in the crossover situation, that's going to vary from one person to another. And there is no stability to where you can look at the eye and be sure of what you're looking at. Okay, and then what's the problem? Oh, I sure am.
It's like a dog with a good bone. Jeez. I had a boyfriend like this once. He had to ask the question just exactly this.
And she wouldn't give up.
He's the one that taught me how to ask questions.
Okay, what I'm trying to point out is don't be too sure of what you're looking at.
I understand that. And I understand there's nothing that is
sacred.
I understand that. But we still have a situation where some of the things, you're using some rule that you know there's a lot of exceptions to, and you don't even want to give us what you started out with. Give us our little grade school thing so we can graduate, and add in the things you've learned in the meanwhile.
Back to the picture.
I think, John, you just asked us, don't be too sure of anything, and I think after this lecture, that's not going to be a problem.
Okay, but bottom line, if you study carefully the Jensen material and study carefully the Deck material, basically, with dozens and dozens of exceptions, okay, which throws out the basics, okay? In other words, you can't count on what I'm telling you. Okay, now you got it? And so basically then, from 11 to 1 o'clock, this basically tells you what's going on in the
left brain.
Opposite brain, in this case the left brain. Now that's all you need to know, and you have to need to know that things are not quite that way anymore because of the wide variation of anatomical differences from one to the other. So you can't be too sure of what you're looking at, and that puts you in a very safe position Because what you're doing then is treating all of the forest on the hills, and you're not getting down to the nitty-gritty of this tree and that tree and that tree and that tree and that tree. When you treat the entire body hologrammically, then these individual trees will heal at their own rate of speed in their own time. And we cannot become a judge as to which one is going to heal first. Doug?
Okay, so basically, we start out at unconsciousness, and as we move up scale to fear, we're going from simplicity to complexity, and we get to a point of total and utter confusion. And then we move back from fear to enthusiasm, and we get to a point of simplicity again.
And then you can encompass the multiple dualities.
So the simplicity that I see at this point is this. Since the brain itself is an organ, and the eye itself is an organ, and you may have a crossover and you may not have a crossover, if you look at the right eye, you might be dealing with the right brain and you might be dealing with the left brain. But of course, the right brain might affect the right side of the body and it might affect the left side of the body. So ultimately, it doesn't really matter. You just have to check both eyes and work on both sides of the body. And then, of course, hologrammically, if you work on one side of the body, you're already affecting the other side of the body anyways.
He's missed his calling. That would be a brilliant speak for a politician or a lawyer. Next slide, please. Okay. David.
One more small point. Actual injuries to the skull, the upper part of the skull, which doesn't actually show, to my knowledge, anywhere else on the chart, would show somewhere up there, wouldn't it?
It shows, yes. Now let's say that you have a problem in the skull, which causes what we'll call a lesion or a calcification between, in the sutures of the skull. That will shut off the flow of cerebral spinal fluid, which we'll get into cranial class. This will shut off the flow of cerebral spinal fluid to certain parts of the body, which all of a sudden another part of the body down here somewhere will start getting a pigment form because the cerebral spinal fluid is not there, the nerve supply is not there, the circulation is not there, and a body part goes completely numb. But that comes from the blow to the skull. You may not see it up here at all, but you'll see it down here in the effect from the skull.
So the actual skull injury is unlikely to be visible in that section?
Chances are you won't see it then, but you will, because the calcification in the sutures doesn't really show up very well in the iris of the eye. Okay, sir? Okay. Now that's important. That's a good question. Okay, Peter.
I know we haven't got to the tie-ins yet, but sometimes when we get a 360 time with both eyes, that explains that everything's connected to everything.
That's correct. Hey, there's a man who understands. And there's a man who is not confused with confusion. You got it? Okay.
After what Doug has just said then...
Did you understand that? Did you really understand that? That was the most beautiful double talk I've ever heard in my life. Go ahead.
Does that mean that for 90% of the result we're looking for, we only have to hold a point on one side of the body? Because it's hologrammic and it's...
That will take care of bilaterally the calcification dissolution on the opposite side, but you still go over to the other side of the body and clean that calcification out also, because sometimes you have specific injury to that part of the body which would cause that to calcify as separate from the right side of the body.
So you still have to do both sides.
You still have to do both sides. That's a good question too. All questions are good questions. All right, let's get back here. See this right here? All there is pigmentation right here. But if you look down in that area, you have, with about a 30 power magnification, you see a network of black cobwebs right here. This is a symphony director in Chicago. He had a huge, huge testicle, in this case on the right side, It was actually the size of a pretty good sized pineapple. He couldn't walk anymore. He couldn't water ski anymore. He felt bad because he couldn't dance with his wife anymore. And all he could do was walk around like this when he had to walk. But all he could do was lay in bed with this huge testicle on the right side that was the size of a pineapple. Now, we worked with homeopathy, nothing worked. We worked with herbology, nothing worked. We had point holding on the testicle points. We worked on the lower back and the spine area, which lead to the nerve supply going to the testicle. Nothing worked. Nothing worked. And the harder we put him on the program, the less things worked. Nothing worked for him. Everything else cleared out just fine, but this huge, this very, very huge area here in the testicle didn't work. So sometimes you deal with straws. So what happened, and I hope you all have a sense of humor. May I have the lights, please? This is a sense of humor. We had the gentleman down here on the table, and his wife came over to the house. We had him in a back room, and we started working with every single point we could think of, acupressure points, acupuncture points, everything from every book we could find. Nothing worked. And then until finally, we decided to go down on the foot and work on the area across, if you know where the fallopian tubes are or the seminal vesicles are. You put a nail in the area here, and you put another one in the area here for the testicles and the prostate, and you draw a line across there, and you hit the seminal vesicles. So we decided we'd go clear across the seminal vesicles and see if anything was there which would have a reflex into the testicle. Well, she hit one spot up in here along that line. And as soon as she hit that spot, he had a little electric shock going from that point right out through the 3 toes on his right foot, which were numb. The 3 toes on his right foot were absolutely numb and had been numb for many, many years. Well, being one who says anything can cause anything, which I didn't believe at that time, but at that time when you're hunting for a straw or a needle in the haystack, anything that gets a reaction, you follow up. So we had her follow up and hold that point, and he'd get another shock coming right down through the 3 toes on his foot. And then a half an hour to 45 minutes later, that shock began to come up into the ankle. And then the shock, after another half hour or so, started moving up into the leg. And after a while, I'll make a long story short, I can draw this out, because the shock kept moving up through the body. After a while, he'd be lying on the table, and the shock would hit him, and his whole arm would go into a shock, and he'd go into a spasm like this. Over and over again, he'd go into a spasm like this. No memory, just a spasm. Some of you are already having spasms in a certain way. You wonder where the heck it comes from. Well, he was wondering where this was coming from. Finally, the wife kept holding that point, and she was getting electricity out of her finger like you couldn't believe. Which back around the 1980s, that didn't happen very often. Well, suddenly his memory was there. Suddenly the memory was there, and all the boys in the neighborhood were lined up on this little wet patch of ground here next to an electric fence. The brothers were in the barn on the control for that electric fence. And the boys were going to be given a prize for who could urinate the furthest on that electric fence and the longest. And so here all the little boys were lined up. The big brother in the barn pulls down the switch. Zap! Get the picture? And here he is with this little ding-a-ling there, hanging out there, urinating on that electric fence with electric shock going through his arm, up through the arm, down through the testicle, down through the foot, and out through the 3 toes in the wet ground. Now, at that time, when he went back and re-experienced that completely, the hernia that he had in this area healed up completely. I remember that so clearly because he had a very bad hernia that he didn't want to operate on. He had a truss for it. That healed up. And at the same time that that happened, then the testicle began to go back down to its full normal positioning. And it was healed. But it was electricity that was stored in the tissues from electric shock which caused the problem. But he had to go back and re-experience it. Now can I have the light on here, please, and the lights off over here, and we're going to have this slide. Take note, please. This area where you see this little spot right here disappeared at that point of time, which would be in the testicle area, and all of that black cobwebbing disappeared. But you have to have one of these little jeweler magnification to see that. And that black cobwebbing is just as real as could be, and that is the suppressed trauma from the electric shock which moved in through that area. Any questions on that? Any electric shock a person has had can be extremely traumatic and long-lasting until that electric shock has been re-experienced and removed from the tissues. And a person holding points can be very, very helpful in that, to help that person to come back to where they had the memory of the electric shock. Down in the hideaway, some of you will remember this one gentleman. I worked on the lady that got hit by lightning. He had blisters all over his fingers after holding, on the inside of the fingers, after holding points on that for quite some time as the lightning was being re-experienced over and over again. Doug.
Okay, there's a principle here that we talk about quite a bit in body electronics. Until man can experience on the mental level that which exists on the physical, he'll be bound to the physical. And you look at this whole thing of going back through the electric shock, and under ordinary circumstances in point holding, what do we do with the body? We hold the body very, very, very still. But bear in mind that for every rule, there's going to be an exception to that rule. And you'll find in these types of situations, like, for example, where John would have noticed the guy's arm, jerking up like that, that jerking up would have come before the memory, because the person is still at the point where they can't experience it on the mental level yet, so they're going to have to kind of reenact it out a little bit physically. So you have to be very, very keen here, and when you're applying this rule of trying to help people to hold still on the table, you have to recognize that there's always going to be exceptions, and when you see these kind of repetitive, spastic type motions, sometimes what you actually want to do is go totally the opposite direction and encourage the person to repeat that, encourage them to get the words that go with it, encourage them to get the feelings that go with it and all the rest, because if you tell the person to hold the body still, in that circumstance, they may just end up suppressing the whole thing again and it won't come up.
I wonder if there's any grief for not winning the prize. We never looked at that part of it. At least I don't remember that, if he did.
He was
okay.
Actually, John, it wasn't grief, it was anger. He was really pissed off.
May we have the next slide, please? Okay. Which eye? The left eye. Okay, that's the left eye. This is rectal cancer. Diagnosed. Next slide. You already know where the rectum is right there. It's right, here's your descending colon, if you remember. Coming down through here. Here's a sigmoid colon. The rectum comes right out here about 6:45. Next slide. Yes, Donna. A lot of stuff going on in the brain area. Okay. What number do we have here?
Yeah. The number? 17.
On your chart, where's the nose? This is which eye? Left eye. Okay. What time? What time again? 10:30. Okay, you go over here at 10:30. You look around up in here, and you see a pigment, kind of a pigment spots all over here. Where if you look at that, now here's what you have to have: the high magnification. You look in there, and you have nothing but black sand from here all the way over to here. Now, normally you find that down here in the intestine. But this time you find it all out here where you have all this pigment stuff. And so this person had a little funny little scratching, itching on his nose. And he went in and had it checked, and they found out there was cancer there. And so they started removing tissue that was cancerous. Now, let me ask you a question. If you start up here at about 10:30, right up here in the nose area, where all this black stuff is, and under heavy magnification is black sand, where are you going to stop? It's all black sand up there. It is all going to be cancerous, or at least the first stages of cancer, and you can go on forever. Now, this is wherein you can go pull a weed out of the garden, but oftentimes there's a lot of other weeds out there. So eventually you have to work with the entire garden. You don't just treat one symptom, because there's going to be more problems there to deal with, especially when you're dealing with cancer. Many of the medical doctors are so narrow-minded in their perspective that they think if they cut it out, it's going to be gone. If they burn it out, it's going to be gone. And this is a very, very, very narrow-minded to look at the situation, because it is the medium or the terrain that creates that condition in the first place, and that's not going to be just limited to one small part of the body.
Coming from a mathematical background, I'm always one for statistics, and with cancer in any of your developed countries, there's really only one statistic that's important for you to understand, and it's a very, very simple one. There's more people making a living off of cancer than there are dying from it. Doesn't get much easier than that.
Very good. Next slide, please. Can we have that door closed over here? Oh, I can't see. Next slide. Got a little spot here, but let's next slide. This is better. Brown eyes are very hard to see unless you have a very bright light, folks. You got to have a very, very bright light. This gentleman I showed you with the brain cancer before, this is the other side of the eye. Okay? That's all you need to look at. There's your brain cancer. Next slide. He lived. Okay, now what time is it right in through here? Now what would that be in the chart? Not 1 o'clock is right at the medulla. What time would that be? Ear? That's correct. Here is you look for the radii sceleris, and you find that radii sceleris in this area. This part right in here will be the inner ear, right there as you see it. And in this particular eye, you're dealing with the left side, and this is where the left ear is totally deaf. It has nothing to do with this. It has everything to do with this and that little black blotch where you have two little black holes right in the middle ear. Next slide. Okay, this person here, this is the left side, this is the man's wife, and she is also totally deaf. Okay, and this is all you see. That's it. Next slide. Okay, this little girl, her name is Amy. She has one major problem. What is it? This is the which ear? Right ear. This is the inner ear right here. She has an inner ear infection. What does she do? She has this bad inner ear infection, and then the thing starts to heal because she's on the program. And then when it starts to heal, it's going to eject all of this junk out of the inner ear. You got all this green stuff pouring out of there. So what does she do? Gets scared, runs back to the medical doctor, gets a great big dose of medication, and then this becomes darker. And at that time, that does stop the flow of junk coming out of the ear. And then she stays on a fresh and raw diet, good because of her illness. The mother keeps her on a good program, and then that thing breaks again and starts to flow again. Now, this is wherein some people, Dr. Bernard Jensen will call this a drug spot. And that would be accurate because the drugs that have been taken by the person suppresses the tissue. And this becomes darker and darker and darker. Any questions on this? Only if what happens? Heavy enzymes, heavy minerals, and then that will start getting better. I don't know if she got better in the end, but her ear got definitely better later on. Doug.
Well, you'll see lots of situations where an individual gets on a very, very heavy program where they've got something serious like that, and they'll get better for a time. They'll go through massive healing crisis. You'll watch the eye improve considerably, and sometimes this goes on for 2 or 3 months, but it doesn't mean they're out of the woods yet, because a lot of people get to a certain point where they're really just tired of the pain, they're tired of the healing crisis, and they just stop doing what they're doing. And I've seen people go through a lot of improvement and then to basically just stop and very quickly sink back into old patterns and end up passing on in a short time.
Next slide. Bottom line, you take a look at these little spots up in here and take out the flare cards of Dr. Jensen and match them up and see what you've got. This is a spot that's part of the film processing, but this is the pigment spot that we'd look at. There's lots of little things here that when you really take a look at them and get a blown-up copy of your eye slides. Every one of you should have a set of eye slides. Is there anybody that doesn't yet? You should have your eye slides taken because over a period of time they change, and then you'll have something to compare it to. But every one of you should have your eye slides. There's about 8 or 9 cameras here. And just get one of these folks to have your pictures taken. You'll be fine. Okay, next slide. Bottom line, take a look at this area up through here and these radii sceleris. And those are very, very meaningful. And I'm not going to interpret any of them now. We don't have the time. Next slide. This is the son of a lady who won the Mrs. America contest. And this is a situation that we had in the brain area. And this is only on the left side. Now, we didn't have it on the right side. Now, we do know that the body shifts where one side of the body is in control for a period of time, and then the other side of the body is in control for a period of time. And then it shifts back to the other side of the body for a period of time. Now, that will vary somewhat from person to person as to the length of time and the length of the shift, but it's a regular biological shifting from one side to the other. You can take a look, for example, some obvious things is a man's testicle. For a period of time, the right one will be much larger than the left, and then the left one will be much larger than the right, and so on. And the different body parts will function in the same way, but the breast, sometime for a woman, the left side will be more tender than the right, and then the right side will be more tender than the left, and so on. And so this is something to consider. But right here, we had a hyperactivity in speech. And when this 50% of the time, when this side of the body took over, all of a sudden he would rattle on and rattle on and rattle on with a million different ideas that would change from second to second, and his speech would be so fast that you would have a difficult time even understanding what he said, because his brain was going a mile a minute. And this is one thing I want you to understand, is that when you have a hyperactivity like this does not mean healing crisis. When you have a healing crisis, you'll have the entire bodily support, and all of the fibers in the body will go anterior, and it'll be as white as a sheet. Is that correct, John? You saw that the other night. Okay, and this is what happens. And so here you have the whole eye will look like this. And then it's when the healing crisis is over, it goes back to this color. But the whole eye will be that color in a healing crisis. If you simply have a hyperactivity or an acute condition in one area, then you'll have the fibers in one area will become very, very white. But that does not mean healing crisis. It means something is going on there where there's an irritation or pain. Any question there? Next slide. Bottom line here, just massive headaches in the brain. That's all I want to show you. And there's something with the black in here, and there's going to be a brain tumor up there of some sort. Doug?
What about with the lymphatics and the pigment spots settling out in the tophi there?
Yes. Now, this is one area that you start looking at. If you have the lymphatic rosary infiltrated with pigment spots, and you look carefully at the pigment spots under high magnification, and you have little piles of black sands that you will have in this individual, you'll have a condition of what they call lymphatic cancer, and another name for that is?
Be your Hodgkin's
disease. And they'll have all the symptoms of Hodgkin's disease.
I've seen a couple people with that type of configuration where they probably did have Hodgkin's, but what they'd actually been diagnosed with would be your leukemia or blood cancer, which may amount to the same thing because zone 6 is your blood and lymph.
That's right. Next slide. Right here, just another problem, pigmentation. It doesn't matter what the symptoms are. You treat it the same way with the enzymes and minerals, and everything comes right. Next slide. Same thing here. You take a look at the pigment spots, you put them on a heavy program, and all of the symptoms gradually disappear, and everything comes right. We're not dealing with this is for that. May I have the lights on for about 1 moment? This is so important. Years ago, back in the 50s, when I first started out in my trek toward natural medicine, I was always thinking, well, what herb do you take for this condition? And I got every single book I could find, and I built up a very nice little library at that time. And I got very confused because one herbalist would say one thing and another herbalist would say anything. Donna, did you read the same books I did? So we've got that type of a situation. Now, I started looking at that, and everything I studied was that everything should balance up the body. This was very reasonable to me. But I didn't get eye color change in balancing up the body. Because my goal from the time I first started looking at eyeballs was what would make a beautiful blue eye in a little baby's eye turn black-brown in about 3 or 4 years. Why would that black-brown eye occur? What could we do to get that black-brown eye back to its pristine blueness at birth? I couldn't figure that out. I see these big black blotches and big holes in the eye like I had in my eye, And I couldn't figure out, well, when I was a little kid, I didn't have that. But later on, when I was about 13 or 14, I had all these big black holes in my eye. I couldn't figure out, clear back in the pigment layer. I couldn't figure that out. Jensen says I was a very sick man, young boy, I should say. And I had a lot of problems. I couldn't figure that out. And so I figured there must be some way to bring the eye through treating the body, which the eye is the window to the soul. There must be some way to bring that back to a natural, pristine purity. And it took me a while to figure that out, because I was still into what everyone else was into, was balancing. You take this for that to either speed up an organ that wasn't working or slow down an organ that was overactive, and herbs did that very beautifully. And then we started dealing back in the early 50s with point holding, and some people would work for and some people it wouldn't work for. Then in the early 60s, I met an old goat farmer. And this goat farmer was telling me this beautiful stuff, this mineral water, which he called it nectar of the gods, that he used on his face when he burned himself terribly during this fire. And how this was used for cancer and used for all these wonderful things, and whatever your problems were, this would cure it. Well, I didn't believe it. So I finally met this old bird who was a doctor, and I talked to him. His name was Barr, B-A-R-R. And we called him Dr. Barr. He was a medical doctor. He was trained in the armed services. And he was using this mineral water to treat everything from hemorrhoids to brain tumors. And I said to him, well, my golly, you have thousands and thousands of patients. What in the world are you doing? He says, I give them this. I put them on a good diet, and that's all that I do, and they get well. And I looked at these thousands and thousands of testimonials, the thousands of them, this high, testimonials that he had from his patients. I thought to myself, well, there must be something to this. So I started using these minerals, and all of a sudden I started seeing eye color changes. I started seeing healing crises in a big way. And these people were on a lot of fresh and raw diet or a lot of organic food, which was very unusual back in the early 60s. A lot of people weren't into that. And having been raised on meat and potatoes, and you got to have that if you want to, you just got to stick to your ribs. Most of us have been raised that way. You got to have your meat and potatoes. And I'll tell you, my parents got upset if I didn't have my meat and potatoes every day. I had my bacon and eggs for breakfast. I had my ham sandwiches for lunch and my pork chops for dinner. And that's what I was raised on. Now, it's interesting that when we got into the minerals on people on good diets, we saw eye color changing. And then things started coming back to its pristine purity. And we've worked it over the years to find out that enzymes are a key, minerals are a key, flax oil is a key, amino acids is an important key, B complex is a key, and oxygen is a key. Niacin will help out to get the nutrients to the cell level. What else do you need, Doug?
You need to get your essential fatty acids there.
That's flax oil.
Your acidophilus you need to
acidophilus. What else?
You need your B complex. You need your magnesium.
Magnesium. We have the B complex.
Lots of other things that have been added. I mean, the Schweitzer and the oxygen.
Schweitzer, oxygen. Now, all of these things we've talked about are on your program sheet. We've talked about them last week. And the thing is the question I had yesterday about Hulda Clark's program on her parasite cleansing program. I've got no complaint with that. But I think I made the statement here, are there enzymes? Are there minerals? Are there flax oil? Is there B complex there? Are there amino acids there? Is oxygen coming back into the system? We have to look at that rather objectively and find out what isn't, because just getting rid of the parasites in the body using an herbal program, a good program, it'll work. But are we getting regeneration of tissue? And frankly, my friends, with the way things are going, I always think of the of your macrobiotic program, where people are dying slowly as they're balanced up, with their pH factor in their body, because there's no enzymes. There are a lot of good programs out here, a lot of good programs for balancing the body, and I have no argument with that. And these should be in your portfolio so you can use them once in a while to balance the body up, to take care of a person. Sometime a person has to go down and get his blood chemistry straightened out, because if the blood chemistry is out of kilter, you can have all kinds of hallucinations and problems that take place. So sometimes you need extra help from a medical point of view. Sometimes you need to go to the laboratory and have a checkup and finding out exactly what the situation is, and get some medication to help to balance that out for a while. I'm not opposed to that. But the long run of it is, let's correct the enzyme mineral deficiencies, etc., as we've discussed, that we can bring a regeneration of the body and see the changes in the iris of the eye. So I did want to share that. Any questions? There must be a question or two on that, because this is getting in kind of touchy issues, your balancing versus regeneration, which I think we've covered a couple of times.
This is not about, balancing, but about you. Did you mention black soil at the beginning, John? What was the first?
The black sand is what it looks like under high magnification in the eye. In the pigment spots, the black pigment spots, you look into that black pigment and you see a multitude of little tiny pieces of black sand.
Black soil. I heard black soil. Yeah, sorry.
Okay.
Okay.
You got that?
Yeah.
Okay, black sand, not black soil. In Germany, you have a black soil there that's very therapeutic. It's like a kind of a clay-like material. It's a black soil that they have.
Black soil, that's what you heard.
Okay, but this is black sand, the pigmentation in the eye. Any other questions? Neil.
Yes, the situation with the medulla. Is that the medulla oblongata?
That's the medulla or medulla oblongata. That is an old, primitive part, the lowest part of the brainstem. It's the oldest primitive part which controls all of the autonomic nervous activities in the body.
That's when we sort of crawled out of the slime? And
Pardon me?
Is that when we crawled out of the slime and started to evolve a bit?
Embryologically, this is where all of the primitive emotions are in the body. The primitive drives, the survival, I must survive type of thing. All that is in the medulla oblongata.
So what I was sort of thinking was, is there any other sort of nerve junction in the body that's of similar, or maybe lesser, but in similar sort of vein?
To the medulla?
Yeah.
The medulla is unique. And I don't think you can find another nerve plexus in the body which is as powerful as that medulla.
Right. So all the others that exist are just very minor.
But you have different plexes and so on down through the system.
Right.
And but the medulla is the primitive source of all primitive emotion, primitive drive, sex, food, survival.
Yeah. So what I was thinking was when you were talking about it there. What I was thinking was that maybe if you orient yourself towards your body, then, the right side goes down the right side. But if you turn back up towards the light, or upwards, then everything's reversed, and you orient yourself, and so the right becomes the left, sort of thing. And so your left side is yin, and your right is yang.
Oh, I'm glad you brought that up, Neil. Because basically, like the corpus callosum connects the left brain and the right brain, and a lot of people learn the left brain stuff or right brain stuff, but we're trying to unite the two like the yin and the yang. And when you connect the yin and the yang together, you don't have all this left brain, right brain business. You have one side affecting the other, and you can't have yin without the yang. You can't have the yin without the yang.
So they're interdependent all the time.
And that's where you get into the duality encompassment. Thank you, sir. John.
This morning, we had an iris or an eye on the screen, and it seemed to me that the pupil was moved across the iris something like that. I've exaggerated it, but way off center. And you didn't say anything about it, and I wondered if there's anything to be learned from such a situation.
Basically, everyone, if you look very carefully at the iris of the eye, the pupil will always be a little bit more medial than lateral. And sometimes that is accentuated. But the eye appears to be perfectly normal, and there's no real problem there unless you have a pupil tonus problem where you have that in your handouts that you can study independently. Okay. Any questions?
I had wanted to ask about a particular person I'd done a bit of point holding with, and it's in relation to keeping the body still on the table and that rule, because I was wondering if there was an exception. And this person had been manipulated by a medical doctor under general anaesthetic, and on the Gold Coast, and he's done this for years. There's a lot of damaged people out there, and a lot of them seem to get a lot of improvement. This particular man he'd never been the same. A lot of his body functions were really severely affected. He was an astrologer. He had to stop doing that because his brain didn't work anymore. Just if he drove a car, he couldn't. His visual, so many disturbances in all aspects of his body and pain. And I think he'd lived on Ruta, the homeopathic, for a couple of years for the pain. And anyway, on the table, and it went on for about 10 sessions. It just kept coming up and coming up. He'd go into the anaesthetic, and then his body would he'd say, I have no memory, and his body would just start contorting into all these positions of the manipulation that he'd been put into. And some of them were really extreme, and I could see, how, the positions he'd been put into. And I didn't know quite what to do, and I said, well, maybe this is the memory. Maybe this is how the cellular memory is. It's all these positions you've been put in. And so we just let him go for it. And eventually he did get word patterns. He had, I'm damaged. That used to come up a lot. And I'm just wondering if, but then you see, he'd be still for a while, and then another whole lot would come out. It just went on. And I was just wondering if when the word patterns came up, if it would be appropriate to get him to be still then at those times.
Sometimes you let a person unravel and let him go through the reenactment of the emotions or the feelings or the physical positions that have been suppressed. There's a time for that.
Yeah.
And then there's a time for holding the body perfectly still and doing as Doug has suggested, where you then experience on the mental level that which has taken place on the physical. And hold the body and discipline the body very thoroughly, because you know that the person can wiggle and squirm and go through all these contortions. Once they've gone through those contortions, then they have a handle on it. Then their job is to now control it and get a deeper hold on the memory.
So both have to be there to complete it.
And you just have, the thing is, don't be so rigid that it has to be a certain way.
Yeah, I'll let him go for it, because...
Yeah, let him go for it. But then after a while, after he's gone for it and he has a handle on the memory, then have him hold the body perfectly still and go through it on the mental level. Otherwise, all you have done is intensify the reactive mechanism.
Well, he got a lot of improvement. Every time he was getting better. But to complete it properly, he'd say the only memory he had was in the word pattern, I'm damaged. You have to work on that and hold the body still.
Okay, let me ask you a question. And in your dealing with him, has he gone through the anesthetic? And the unconsciousness and the numbness on the body?
Well, he'd say on the table, I'm going into the anaesthetic now. And some of them were very light anaesthetics. So some of them he had more consciousness, or some consciousness of what was going on, and he could tell me about the doctor. Some of them were deeper.
Did he go through the numbness?
Unconsciousness on the table?
On the body. Numbness on the body.
I don't know.
Now, the numbness we have to get through. And you don't go through that numbness until you hold that body perfectly still for maybe 2 to 3 hours. And hold that body still no matter what. And then you not only go through the numbness, you go through the neck pain, you go through the memory of the manipulations and so on. But we have to get that numbness out. And that's why there is a time for holding that body perfectly still, not for 5 minutes, and then go through some other fish flopping around. We don't want that. I'm talking about 2 or 3 hours of perfect stillness to get that numbness out, that we can start getting a grip on the higher levels of emotionality.
In the beginning, to get him to hold still?
It doesn't have to be in the beginning.
At some stage.
At some stage, you have to have that body perfectly still. And you're going to have to use your own judgment, because let's say the person's not willing to do that because of the pain. See, you've got to be wise. Now, if you know the person can do it, then say, hold that body still and get right in there and just be nasty. Then give them a good hug afterwards, letting them know you still love them. But the thing is, you have to really force the body to be in control, because the body becomes actually the springboard for moving into the emotional realm, and then eventually to the mental body.
So after he would have gone through all those contortions and what have you, then he should have been made to keep still and
that's right.
Work on a deeper level.
Because going through the contortions is only a temporary reprieve so that he will feel better. But you don't get to the mental body until you can control the emotional body and go through the burning. You don't get the burning until you hold that body perfectly still and go through the unconsciousness. Okay? Okay. Good question. That's a good question for all of us.
Do you let a person sleep, and for how long?
If you're poking them in the rib here in the heart area, or you're holding that pineal where you know that there's pain there, they'll go through the unconsciousness, which you think is sleeping. Let them sleep until that wears off, and then eventually, when they come to, they say, my foot's burning off. Okay? And then you work through that. But that unconsciousness or sleeping, don't say, hey, pay attention and try to wake them up. Let them go to sleep and let them work through that, because they're probably burning off a lot of unconsciousness. Okay?
You talk about the not working on a person that has problem on the back, that has cancer, on the back.
Until it clears up?
Yes.
And then you start working on that area.
I want to know with Hodgkin's.
With Hodgkin's, same problem.
It's the same thing.
We've had lots of Hodgkin's disease, and what you do after you've been on the program for 2 or 3 weeks, and you know that the person's getting better, you can go on the lumps that they have up here in the lymph nodes. They're all puffed out there. Just hold it, and it just goes right away. A couple of hours, and all the lumps are out of their neck, and it's just amazing. All the lumps down in here, wherever the lumps are, just hold it gently, and down she goes. Because you're getting the nerve supply and circulation back in there now, and it just heals very quickly. Okay, yes. The Hodgkin's, were you here when I showed you the lymphatic rosary with all the pigment spots in it, with the black sand in the pigment spots all the way around? That's Hodgkin's. Okay.
Dealing with the unconsciousness again, I had a situation last night that happens to me quite a few times on the table, where I'll go through a memory and I'll get some emotions up, and then I'm just about to go up to the next level and I get really sleepy, and I'm not sure if that's unconsciousness or actually a form of resistance coming up. I think it's more resistance with me than unconsciousness, because I get really tired and then I think, well, I just don't want to do anymore. Is there a way of knowing the difference?
Yes, look at the word pattern. I'm tired and I don't want to do anymore.
Yeah, okay.
Take a look at that and have fun with that one. That's a good one. Other questions? Okay, can we have the next slide, please? Okay, just simply that big black blotch up there. Do you see that? Terrible headaches, passing out, and just let that one go. Just let it go. Next slide. Terrible headaches. See that black blotch up there in the brain area from 11 till 1? You've got to get some, remember we talked here about getting the first cervical vertebrae in. Next slide. More and more headaches. Next slide. Young man, on his x-rays, as I recall correctly, the bones on the left side of his body were underdeveloped, especially in the back area and the vertebrae. And he had that pigmentation right across there from side to side. And after we got the feeling back into his body, nerve supply and circulation, a year later, everything had grown back to where everything was symmetrical, and the left side of his body, the right side of his body was not under. This should be a right eye. It is a right eye. The right side of his body was not underdeveloped. Tom.
On these brain tumors and everything, would we go into doing a cranial on somebody at that time or not?
No, you don't do any cranial work until after you have complete body electronics work done.
After the nutritional program first.
Nutritional program first, and a complete program of body electronics. Get the spine perfectly straight first, get the tailbone straightened out, and then you gradually go in and work on the cranial work.
It would be detrimental to his health then?
On a cranial?
Yes.
Never give a cranial right off the bat.
Okay.
Never. Next slide. Bottom line, I just threw this in here for you. This is the person who's chronically on marijuana. Next slide. Another person here who's chronically on marijuana. Next slide. And this one is another person chronically on marijuana. Please take a good close look at the catarrhal effect over the fibers of the eye. That white catarrhal effect. Now, marijuana is a painkiller. It suppresses the ability of the person to experience pain. And this is why pain is necessary for body electronics to work, and this is why marijuana and body electronics simply do not fit together. Next slide. Let's get into his little sclera now. Doug, right there at 9 o'clock in the sclera, do you see where that degeneration line moves down? Now watch it, everybody. Watch it. Come down, and then suddenly it goes way in. No, it doesn't go way in that way. It goes right there, and then it bends back. You see that? Mark this down. When you see that type of a thing in the sclera of the eye, you always look for a degeneration factor from there in toward the pupil. This is a heavy, heavy brown eye with very heavy velvet covering, but the person is knowingly suffering from lung cancer. That's the sign in the sclera. Right here. See that? Where the degeneration line comes in and goes back out. This you look for in every eye that you see. Next slide. Pardon me? We will. We're going to go into in the advanced procedures. We'll have that for you. We'll have 2 solid days of sclera. We'll have it then in the 5th week. Okay. Now on this particular eye, you take a look in this area here, and you take a look at the lymphatic rosary. Look how this is pushed in toward the pupil. Always look at the lymphatic rosary. That's all I wanted to show you, just to remind you. Next. Now what do you see? You see 1,000 things. You have your squaring off, you've got your pigmentation, you've got your black sand all through here, all the way around. You know that all of this has to heal first before the rest of the body will heal. You got a little cataract showing up in the pupil, or in the back in the lens of the eye. You got so much there, okay? Next slide. Come up here, grab the mic.
One thing we haven't commented on is a break in the autonomic nerve root. Is that a break in it, just in here, or not?
Right in this area here, you cannot see the autonomic nerve wreath. You just don't see it. And there's a break in it. And where there's a break in the autonomic nerve wreath, that shows that that part of the body will not heal properly. Next slide. Okay? Please note the big black bush up here. I don't need to say anything more about that. I did have a case with a lady who came to see me. She was in Hollywood, and she was one of these voice teachers that took care of a lot of the Hollywood movie stars. And in the neck area, remember the neck would be right about 1030. In the neck area was a black area about this big around, a great big black bush. And I looked at her, and I says, do you have a problem with your neck? And she said in her accent, she was French, she said in her accent, she says, which I cannot duplicate a French accent, she turned around and showed me a huge tumor, a huge growth on the back of her neck the size of a large grapefruit right here. And I looked at that. Lights, please. I looked at that, and she said that she had been to the medical doctor, and that for her to get her affairs in order, that the cancer had gone into the spinal cord and it was inoperable. Well, I told her, what do you want to do? She says she wants to live. Okay, that's the way it is. Now here's what you have to do. And I told her exactly what to do. Get on the program, enzymes, minerals, etc., etc., etc. But the enzymes at that time came from fresh and raw food. No more French pastries. You know, she had to really toe the line. 2 weeks later, I was down off of Wilshire Boulevard in Los Angeles, and I was working with the people down there. And she had made an appointment to see me and came in, and I didn't recognize her. She had on one of these Hawaiian mu'umu's, and she was just covered with red running sores. And she said, "Look what you've done to me." I said, "Ma'am, would you please help me out a little bit? What's your name?" "I'm Madame So-and-so." Madame So-and-so. I didn't recognize the voice either. And I says, "Madame So-and-so, yes, I saw you over here in Burbank, and you put me on a program 2 weeks ago. And I'm covered from head to toe with these red running sores." You want to be an iridologist, huh? Okay. So at that point of time, you have to use a little bit of diplomacy. And you tell them everything is just absolutely fine. The body is cleansing itself of toxins. This thing on the back of her neck, which was hard as a rock before, became red and weeping and the most stinking stench you ever saw in your life. And I said, "You're doing absolutely wonderful. Don't change a thing. Stay right where you are." By that time, after 2 weeks, that black bush had nubbed off. And I knew that I was on firm ground. You follow me? It's still black. About 2 weeks later, I saw her again, and the thing was turning brown. This thing had gone down to where it had gone down considerably. And I saw her just a short time after that, maybe 6 weeks, and all there was just a little red spot in the back of her neck. The tumor had gone completely away. And this beautiful radiant 70-year-old lady came in. She was absolutely gorgeous. She said, I have a new musical creation. I was invited to go to Paris, France to present this before some symposium. Can I go? I said, how do you feel? She said, I have never felt better in my life. At that time, I explained to her about when you never feel better in your life, that's just before you go into a healing crisis. And she says, I've already been so many healing crises, I can recognize them. And I said, do you want to go? She said, I want to go and visit my family and my home and whatnot. And as I recall, I got wind from her for about 10 years later, and she was still doing absolutely wonderful. New lease on life. The black bush was just a smatter of little brown pigment there, and had gone. The black was completely gone, and the brown pigment was just breaking up. Now that's the type of thing that you're going to have. Don't get concerned with the outer manifestation. Realize that as the inner consciousness changes, and as the person really wants to live, and they're really dedicated for continuing on, and they're willing to go through the pain without complaint. How many of us, when we go through a healing crisis and we're uncomfortable, our comfort zones are not only just where we're having our buttons pushed, we're getting our comfort zones ruptured to the core. How many of us come kicking and screaming and saying, I don't want this? Guilty? Anybody with me on that? Okay, and when that happens, you just keep right on going and learn to be grateful for the healing crisis and transmute the whole lot. But anyway, that's a very important thing on that particular aspect. There are many different areas that we could talk about individual cancers, cigar-shaped cancers, and so on, black blotches in different parts of the body, and you've got that. I would like you to move down basically to number 53 on the chart, or on the slides. Number 53, quickly. Yes.
Was this lady that you've been talking about, was she on a very heavy point-holding program as well?
No point holding at all. She was only on a nutritional program. No point holding at all, Vivian. None. None. Just simply the joy of life was her point holding. And when her body went through the changes, that was her point holding, just living from day to day. Do you understand? No point holding. Don't create a dependency relation on point holding, because when you're living moment to moment with love in your heart and forgiveness in your heart, then that's your point holding, because that'll bring up everything universal under the sun for you to experience. Okay, right here, you see this? This is called your sectoral heterochromia. And here's where you just have a brown segment. Now that'll go away under the program. Next slide. There's another sectoral heterochromia. It just means this is a brown spot and then the rest is all blue. Now many of your books just cover that, and they put no significance on that whatsoever. The significance I would put on that is that there's no nerve supply, no circulation in here, and not enough enzymes and minerals. You get that in here, and all this brown disappears. Next slide. Okay, here's just another sectoral heterochromia right here. That's all. Next. And here again, this used to be sheer black right in here. Okay, and this used to be brown all the way from here and all back to here. And from 11 o'clock to 1 o'clock, there was no brown discoloration whatsoever, which would be the brain area on the opposite side of the body. Now, this person, all the black disappeared. May I have the lights, please? You want to have some fun now? Okay. A person's down at level 7. They're sicker than a dog. They're unconscious. You put them on a program, you have points, the black pigmentation starts disappearing, they start feeling a little bit better, they come up to apathy where they say, well, I just can't do this anymore and I can't do this anymore. And you keep working with them and they come up to grief where they're crying all the time. and they're crying all the time because of this and that and other things that they've been stuffing for years. And then they come up to fear. And what happens when they come up to fear? They do run away, and they're gone. And no matter how much you educate them about this, that feeling is so intense that they're gone. They come up to fear, and they can't take it anymore. They're not going to do this anymore, and they do something to justify themselves so they don't never have to do it again. And so they went, this lady who was totally into a Catholic-type life, she joined some Pentecostal-type religion, where from that time on, the Pentecostal says you don't have to watch over your body. You just laying on of hands for the healing, and that's all you need. And don't worry about your body. Don't worry about vitamins. Don't worry about your nutrients. Just all you have to do is by grace are you saved. And all you have to do is accept Jesus, and from that time on, it's all done for you. You follow what I'm saying? And you're going to find people, they'll change churches, they'll change religions, they'll change friends, they'll change mates, they'll change partners, and it makes it a very, very difficult thing for people, because people have to shift and move around just to keep up with their best friends, or they lose them. Just it's the way it is. But a lot of changes happen. But I just want to show you that different sectoral heterochromia. We handled transversals. We handled lymphatic cancers. I'd like you to come down to number 73, please. Number 73. Take the next one, please. Next one. There we go. Okay. How do you read a brown eye? First of all, you have this heavy brown pigmentation sitting on top of the fibers. So what you have to look at is look at it and imagine that you're on an airplane going over a mountain range which is fully forested. You can see the ridges and see where the ridges are by the trees on the ridges, can't you? But you can't see the ridge, but you know it's there because the trees are in a certain configuration indicating that you have a ridge under it. So you have to take a look carefully at the pigmentation and find out what the structures are under that, and learn how to read the closed lesions which show up through, oftentimes, the pigmentation. Now, oftentimes you have a black pigmentation like this on top of the brown chromatophores, and that will tell you something that will need attention. The rest of the time, you're going to have to use the sclera. You're going to have to project ahead in time what you will know, because here you have your little hamburger effect, as Doug has instructed you, and that shows gastrointestinal disturbances. And you know that as the brown pigmentation starts to diminish, it starts out here at zone 7 and gradually moves in, and the last place where the brown disappears will be in zone 1 and zone 2, which will once again indicate your gastrointestinal disturbances and problems and enzyme deficiencies. But the more that you correct those enzyme deficiencies, the faster that will eventually clear up. Now, any question on that? That's the first thing, is your digestion. Okay, after you get over your digestion, you take a good close look at the autonomic nerve wreath and read that. And you can usually read that in a brown eye unless the anterior chromatophores are so heavy where you have that velvet color that you can't see anything under it. And then you just put a person on a regular program until that brown comes off, and then you can work with that, what you see under that, and then you get scared because you realize how much you haven't seen, which needs a lot of attention, especially with the body electronics work. Okay, next slide. Now, the brown eye, again, you go by the radii solaris and you get your little grid, and any radii solaris that you have will tell you pretty much which organs will need special work on. So your radii solaris and your nerve rings will show up in a brown eye. And in a brown eye, the first place the color will start coming back will be down here in the nerve rings. And at first it'll be kind of a light brown as it starts changing, and then finally you'll see a little bit of green coming through in the nerve rings before any color change happens anywhere else in the eye. Next slide. Is that black enough for you? There is a black-brown eye, and you can scarcely even see the pupil. Now that's where you get into very black eyes, and you're going to have to go to the sclera. Now I guarantee to you, even an eye like this, like what Anita used to have, a black eye like that, and she had a black-brown eye, and her father's eye is black-brown. And it just black as could be. Now that will eventually turn dark brown, then light brown, and then the green will start to appear through the nerve rings that you cannot see, but they're there because under heavy light they're convoluted, and they're so convoluted you can't see anything but the convolution. That's just where you have this big dent down into the tissue. But then eventually that'll show through, and then you use the sclera of the eye primarily as the indicating tool for what you're working with. Doug, anything you want to say, sir?
Nothing other than the fact that a lot of times you get a person with an eye like this and you put them on a really heavy program, and maybe 4 to 6 months down the line when the eyes lightened up a bit, you wish you'd put them on an even heavier program because you can start to see what's really there.
That's correct. Next slide. Another brown eye, but you can see here what's this called? The sodium ring, mineral ring, or cholesterol ring. You can see just a little hair of a blue ring around here. You know that the person needs a lot of digestive corrections, and you can see some little black spots like this up in here, which would indicate that blue spots are there, and the person is really quite tired all the time, and they need a lot of correction. And here again is where the pupil. John, you there? John Sears? Here's where the pupil is very much off-center toward the nose. Okay, next slide. Another very, very brown eye, and sometimes you will check this area here where you have individual pigment spots like that, and you follow that into the pupil, but you can't see much. The same thing here. You follow that into the pupil, but you cannot see much. But here's where your heavy, heavy black-brown eye is very difficult to read. Next slide. Same thing here, just difficult to read. Next slide. Okay, put in the next case here, Doug, if you would, please. Light.
Talking about different colors. I have a niece who has one eye brown and one eye green. Does it change with the program?
Usually, what I have found, if one eye is brown and one eye is green, is if you have an adjustment on the first cervical vertebrae again, it restores the nerve supply to the area that has been deprived for a long time, and the eye immediately starts to change color if the nutrients are there. And but it means that one side of the body, for some degree or other, is shut off.